Alright, what I'd like to talk about today are what we call the three occipital Atlanta locks that Dr. Blair described. And the reason we talk about these locks is it describes why the atlas moves the way that it does. So before we talk about what we call the Blair principle of misalignment, I'd first like to talk about the three locks. First lock in the Blair work that we talk about is what we call the convergence lock. So looking at me, this is anterior, or you're looking at this person from P to A like you would on a normal x-ray. Anyway, the first lock that we talk about is called the convergence lock, and that is how the condyle converges towards the anterior. So rarely you will see the condyle straight forward, but most of the time both of the joints left and right converge towards the anterior. Now what I want you to imagine, which kind of illustrates how this lock works, and when we talk about locks, we're talking about two-dimensional movement, not three-dimensional movement. But if you imagine a train going down tracks and some joker at some point ahead of the track, or ahead of the train, took those tracks and started to converge them towards the front. As that train, let's say it's not going very fast and there's not a lot of momentum, but as it hits those tracks that start to converge, that stops it from moving forward, right? Because the wheels, as it hits the convergence in the track, it stops it. So, in a two-dimensional framework, the convergence angle of the condyle stops purely anterior motion of the atlas relative to the skull. And it also, imagine this train that's going down the tracks, that's converged, and the train locks to a halt. You would not be able to rotate that train left and right. So again, convergence lock limits anterior motion and also limits pure rotation of the atlas relative to the skull. And I know this flies in the face of lots of things you're going to be taught in school, but we're just presenting the Blair information to you. So first lock, convergence lock, limits anterior motion, rotation. Second lock is how the superior articular facet of atlas slopes to the horizontal plane. We call this the slope angle or the slope lock. So if the joint is horizontal to the ground, that would be 0 degrees. As that joint starts to tilt, and again this is different for every person, we call that the slope angle. And of course if that joint was completely perpendicular to the horizontal plane, that would be 90 degrees. Now, so what does that have to do with this locking mechanism? So if you can imagine, as that slope is like this and the head condyles fitting in there, the slope lock limits purely right and left laterality, again in two dimensions. There is no right and left laterality in two dimensions between the atlas and the skull. So that's the second lock. The third lock that we talk about is the convexity lock. And that is the condyle-atlas relationship. It's the only joint actually in the spine that is not flat. It's cup-shaped, right? And this, again, will lead into how the atlas moves here in a minute. But imagine you have this cup shape like this, and you have this ball sitting in it. There is absolutely, in two dimensions, there is no anterior or posterior movement. It's locked in there. It can't do it, right? So the convexity lock limits pure anterior to posterior movement in two dimensions. Now, getting to how the atlas moves based on what Dr. Blair talked about. And a lot of what we're going to talk about has actually been confirmed on CT and MRI, but that's a topic for another discussion. So normal biomechanical motion between the head and the atlas is the nodding motion. Yes? When the atlas dislodges out of position from a trauma, what happens is you get what we call tracking motion on the condyle. So let's review this again. We got convergence, right? The joints are converging towards the anterior. And let's just take the left joint. When the atlas dislodges, because of those three locks that we talked about, it actually moves three-dimensionally in what we call a torque twist. And it will track along the convergence angle on one of the sides, and we'll pick this one just for argument's sake. The atlas will track forward along this angle, right, as it translates out of position in a three-dimensional torque twist. So I want to go back to the train analogy. Imagine you have this train and the tracks at the head have been converged towards the anterior, and let's now, instead of the train stopping, let's imagine the train has one wheel that stays on the track as those tracks converge. What's going to happen to the other track, or the other wheel on the track? Is going to have to jump off. In other words, as the track converges and one of the wheels stays on, if it's going to stay on, the other one, by just purely mechanical reasons, has to jump off of the track, right? So what happens when Atlas moves in a subluxated motion along the convergence angle here, it has to jump off of this track over here. Yes? If it moves backwards along this joint, it's going to have to slip under the track here. And just take that to the other side. On this joint, again, the convergence is this way. It's going to naturally move along the convergence angle here, and it's going to jump off of the track here. And if it moves backwards along this joint, it's going to jump under the track here. So there's four main movements which are predicated off of that biomechanical locking mechanism we talked about. Those three locks: convergence, slope, and convexity. So four main movements, again, that move along convergence angle: backwards, forward along this, and we call that the track condyle. If the vertebra tracks along this condyle, it's going to jump off of this condyle. We call that the overlap condyle, and that actually will be the next lesson, where we talk about the four main listing systems of Atlas relative to a stable occiput, and what you would see on X-ray, and we'll have X-rays on ViewBox to talk about that. So, to recapitulate, three locks: convergence, slope, convexity, and those three locks are limiting how that Atlas can move, and the reason the Atlas moves in the way that we talked about is because of those locks. Till next time.